Does IBS cause lower back pain? By Dominick Hussey, functional medicine and osteopathic manual practitioner. In my practice, clients with primary presenting symptom of lower back pain often also report having irritable bowel syndrome, IBS symptoms, such as bloating, constipation, diarrhoea, and gas. To the client, these two conditions appear unrelated, but are they? Does IBS cause lower back pain? Researchers found that IBS is associated with unrelated extra-intestinal symptoms including chronic fatigue syndrome, depression, and fibromyalgia. Association of symptoms means that they usually appear together. It does not mean that one condition may cause the other. For example, just because many of my clients with lower back pain also have IBS does not mean that the latter is caused by the former. To say one condition causes another, you would have to observe that by treating one, the other also resolves. In this video, I will outline a client case study whose back pain and IBS symptoms resolved on a low FODMAP diet. Meet Kelly. Kelly, 35, is a yoga teacher working in downtown Ottawa. While participating in a yoga class I was also attending, I noticed that she avoided doing any postures that involved twisting. After the class, I asked whether Kelly suffered from lower back pain. She said she did. Kelly explained that pain had started some 4 weeks previously. She had been receiving chiropractic care with a limited reduction in symptoms. I indicated that if physical symptoms do not respond to physical therapy, then there is often an underlying condition that is driving the problem. I suggested that she come for a consultation with me so that I could assess her back pain and what might be causing it. A week later, she came for an initial consultation and I took a full medical history. As well as suffering from lower back pain, she also complained of digestive symptoms including abdominal discomfort, bloating, diarrhoea, and gas. She had experienced these symptoms since she was a teenager. She had tried removing gluten from her diet to help her symptoms, which it did, but said it was too stressful to maintain the diet. On examination, identified that her muscles were hypertonic or tight, and a couple of her primary muscles that support her lower back were not functioning very well. I explained to Kelly that in my experience, over-tight and poorly functioning muscles are often a cause and sign of low-grade inflammation. Furthermore, this inflammation often stems from problems in your digestion. Some years previously, Kelly was referred by her family doctor to a gastroenterologist about her digestive symptoms and was diagnosed as having IBS. Recent research has found that approximately 80% of people with IBS have a condition called small intestinal bacterial overgrowth, or SIBO. SIBO is a condition where your friendly bacteria that normally live in your large bowel overgrow into your small intestine. One of the functions of the friendly bacteria is to break down fermentable carbohydrates known as FODMAPs. When this process occurs in the small bowel, it can lead to a build-up of gases causing symptoms of bloating, constipation, diarrhoea, but also inflammation that can spread throughout the body. Research has also shown that a low FODMAP diet can help reduce symptoms of IBS. With this information in mind, I explained to Kelly that I thought that her poor digestive health might be causing her back pain and suggested that she try following a low FODMAP diet for 2 weeks. Due to her experience of following diets, she was a little anxious but said that she would think about it. I said that was of course her decision and to do what she could manage without getting too stressed. 2 weeks later, at our follow-up appointment, she said that on reflection she had decided to embrace the diet fully. Furthermore, she reported significant improvement in both her digestive symptoms and lower back pain. Interestingly, she noticed that on one occasion when she veered away from the diet, she observed the following day that her lower back symptoms were worse. In conclusion, based on the clinical outcome, we could assume that Kelly's back pain was a result of her IBS. Can we expect that everyone with low back pain and IBS will have the same outcome? The answer, of course, is no. To make that conclusion, we would have to carry out a much larger study. That being said, changing one's diet is a relatively low-risk therapeutic intervention compared to, for example, long-term use of anti-inflammatory medication. If you do suffer from lower back pain that has not responded to physical treatment and at the same time suffer with IBS symptoms, following a 2-week low FODMAP diet would be a safe option. This video is for educational and informational purposes only and may not be construed as medical advice. The information is not intended to replace medical advice offered by physicians.